We're at West Berkshire Community Hospital, where older persons' mental health for Newbury is based, but we also have a base at Wokingham Hospital and also at Hazelwood, which is at Prospect Park in Reading. What we offer is mental health services for older adults, anybody over the age of 75 years who is struggling with activities of daily living, or maybe they're feeling anxious and depressed. We also run a memory clinic, and that's for adults of any age who are struggling with their memory or have concerns about their memory, and we offer them assessment with the psychiatrist or with the community memory clinic nurse to do some in-depth assessment as to what may be causing some of those memory issues. And then from that we offer some post-diagnostic support in terms of carer support. We also got speech and language therapists, occupational therapists, psychologists who can offer some of that kind of psychosocial support.
So lots of people that come through and have assessment for their memory also have assessment for difficulties with finding their words and difficulties with their communication. And some people can forget things like, how to read, how to write, and communication can be very difficult. So I will assess people that come through the clinic where the predominant symptoms might be speech and language symptoms. So their memory difficulties may be mainly to do with communication rather than forgetting processes. So they might, still be able to be driving, looking after themselves, all their activities of daily living, but when it comes to communicating and conversation, they have real difficulties. So I will see and assess those people and provide support and exercises and guidance.
Most of our support for patients is done in their own homes. We want to go where people feel more comfortable, so we often see people face to face in their own homes. But we can also offer support with activities of daily living, so it may be that somebody might have lost their confidence to go out, and we've got support workers who can support them with that, or it may be that somebody's lost perhaps their confidence in cooking, so we've got occupational therapists who might be able to do some graded activities. We've got support workers who can help people access social activities, or it may be that they need help with their medication picking up, and it's quite time limited support, but it's very focused, and it's about just helping someone kind of get back to where they want to be as much as possible. Generally there's a lot of one-to-one work, but there is some group work as well, so we offer something called cognitive stimulation therapy, and that's where somebody might have had a diagnosis, and it's a psychosocial intervention that kind of helps them. It's not going to cure dementia, but it kind of can help slow it down, or perhaps look at strategies to help somebody with their memory. And that's a 12-week course that people can come in and meet in groups with other people who are also experiencing the same thing. Because we often find that people feel that their world becomes very small, and they're often very nervous about interacting with other people. But if you come across somebody who's in the same boat, who's having the same symptoms, experiencing the same things, that often can give them a little bit of confidence. And so we like to kind of have some group work as well, but also as well, some people we just try and help them access some community groups. So generally one-to-one, but there is some group work as well, and the carers support group as well is very much a group activity.
The courses run over 6 sessions, and we cover from what is dementia right through to signposting carers and family members to some of the support services in the locality. The same course is delivered across the trust, and the 6 sessions are repeated throughout the year. So some people might come on and only manage a couple of sessions of one course, and then can pick up the other sessions on other courses if it suits them. We run the courses in the evenings, we run the courses during the day. We tend to rotate and have a timetable of different days and times of the week, so they're accessible to as many people as they can be. We cover, first session is all about dementia, so people understand some of the physical changes that their loved ones are experiencing. We move on to looking at some behaviour changes that people might be experiencing in dementia, and we give carers and family members some strategies for dealing with those. We then look at communication. We look at some of the communication changes people might have witnessed or people want support in. So that can be around looking at aids that people might want to, carers might want to purchase for their loved ones. Then we look at some of the physical changes that dementia may bring. And then finally, we look at some of the legal aspects. We have a solicitor join us. We look at the welfare benefit system, how that can support people with dementia. And then we signpost people into the community. West Berkshire is very fortunate in having a lot of support services around. So it's very important for us when we come to the end of the course that we're introducing carers and family members to other people in the community who can support them moving forwards. As part of the course, we encourage people to share as much as they feel comfortable with, and we will work with them to create a contact list so that people can hopefully stay in contact beyond the course. And I have had carers who I've met in the community who are still in contact with people that they met on the course 3 years ago. So there is an ongoing support that people can get from other carers, other family members who are experiencing the same thing as them.
Anybody that is experiencing memory problems is going to be feeling really anxious and quite frightened about that. And our service is here to support people through that, through what could be a difficult diagnosis, but it could be that memory problems could be associated with physical health, or it could be a mood element, and we want to be able to weed out what the problem is. But I would encourage anybody that's struggling with mood or memory to contact their GP and ask for a referral to our services, because we're here to help. We want people to come and help. That's what we're here for.